So, now let us look outside Norway. Mulig at jeg nå lager dette veldig vanskelig for de som oversetter, for de som ikke snakker norsk, da de får engelsk oversetting. Det slo meg plutselig at når jeg begynner på engelsk, da, hva skal de da gjøre? Det var kanskje en veldig dårlig idé. Jeg fortsetter likevel, for jeg har tross alt skrevet opp. Now let us look outside Norway and invite one of the world leading experts within the field of behavior and development genetics, with more than 300 clinical studies published. Dr. Randi Hagerman is a professor and the founder of the Mind Institute at UC Davis, Sacramento, United States of America.
Is that okay?
I think she came to Norway early in the 90s the first time and came back 10 years ago attending a conference in Oslo. I also know that Dr. Hagerman has family in Norway, which makes her even more ours. Norwegian will like to think that all kind of famous and talented people abroad have some connection to Norway. Very humble. Thank you, said the Swede in front. Please welcome the queen of Fragilt X, Professor Randi Hagerman.
Thank you very much. I'm very honored to be here, also with the princess, and thank you for the invitation. I come from California. My father was a sea captain in Bergen, so I'm half Norwegian, the other half Dutch, but we won't talk about that part. So here is the Mind Institute, which stands for Medical Investigation of Neurodevelopmental Disorders. And here is a team of people that I work with at the Mind Institute, and I'm going to talk today about Fragilt X disorders because it has been an area of great interest to me for many years. This is an area that is exciting because Fragilt X is leading the way for targeted treatments. And I think that the next 60 years at Frambu will be focused on using a combination of new targeted treatments to reverse neurobiological abnormalities in many of the rare disorders that you see, combined with excellent educational and behavioral interventions. And this is really a new age of targeted treatments, not only for Fragilt X syndrome, and I'll talk about a few of the targeted treatments that has been helpful for this disorder, but also targeted treatments for Angelman syndrome and Prader-Willi syndrome. Growth hormone therapy has been extremely helpful. New targeted treatments are available now for tuberous sclerosis and being studied. Also Rett syndrome with some very positive things from IGF-1 therapy. And even in Down syndrome, the new drug GABA-A alpha-5 inverse agonist, a long name, but to alleviate some of the intense GABA inhibition that is occurring in Down syndrome and leading to some of the intellectual disabilities, and some of the results from preliminary studies of this medication has been very helpful. And so I think that there are many commonalities across disorders, and I think that the rare disorders teach us a lot, as I will show you in just a bit, about some more common disorders among the general population. So we have a lot to learn, I think, from studying the new treatments for many of these rare disorders. So let me just introduce you to Fragilt X syndrome. This is just a disorder caused by a mutation on the bottom end of the X chromosome. And the kids are very cute, as you see here. I fell in love with these kids more than 30 years ago. Some of the clinical features are a long face and prominent ears. I think you see slightly prominent ears here. But most of the kids actually don't look dysmorphic or very unusual. They can be very hyperactive, very anxious, and quite impulsive with a short attention span. Sometimes they can have outburst behavior, which leads to more intensive treatment. But as you can see here, all of them are very special kids. In some parts of the world, and these are some studies that we have been doing in Colombia, in South America, there are pockets of individuals with Fragile X. In this small village in Recarte, Colombia, the village is about 2,000 people, and there's probably more than 100 people with Fragile X there. And it seems like it was a founder effect from the conquistadores, some of whom were carriers, and this town was founded by 3 families related to conquistadores, and many kids with intellectual disability caused by Fragile X stayed there, and then the population increased over time. And so we've been working with a local university and many of the students there. Another village in Indonesia has more than 50 individuals with Fragile X. So this is an inherited cause of intellectual disability. The individuals who are affected by Fragile X are about between 1 in 3,600 to 1 in 5,000, depending on what part of the world you look at. The front end of the gene has a repetitive CGG repeat that becomes methylated when the repeat is more than 200 repetitions, and the methylation is in orange here, and that kind of shuts down the gene. So there's very little messenger RNA produced, and it's really the lack of the Fragile X protein, a very important protein for the development of the brain and synaptic connections and synaptic plasticity. And so the lack of this protein leads to Fragile X syndrome. But what's far more common are the carriers, and many of you have encountered carriers who are mothers of kids with Fragile X syndrome, and sometimes their fathers are carriers too. So carriers can be male or female, but they have between 55 to 200 CGG repeats. And carriers themselves, even though they usually do not have intellectual disability, they can have a variety of other medical problems. And this is because the CGG expansion here between 55 and 200 repeats compared to normals, which are less than 45 repeats. The carriers produce way too much messenger RNA, and sometimes that can make them quite intelligent and driven and very successful in life. I've met many doctors and lawyers and jet pilots and all kinds of people who are very successful in life. However, carriers can also develop some problems themselves. Occasionally we see carriers that have autism or intellectual disability, but more commonly early ovarian failure. That means menopause before age 50 is a very common problem in carriers. More than 20% have this difficulty, and it is the major genetic problem for early ovarian failure or primary ovarian insufficiency. We call that FAXPOI. And then also aging carriers, because of too much messenger RNA, can develop a Fragile X associated tremor ataxia syndrome, and I'll show you some pictures of that, and that's called FAXTAS. It looks kind of like Parkinson's disease, where they developed an intention tremor and balance difficulties. But many carriers can have depression and anxiety, particularly mothers who are raising kids with Fragile X, and we thought originally that maybe that was because raising kids with Fragile X syndrome can be difficult because of their behavior problems. But now we know that Depression and anxiety can be related to some of the mitochondrial dysfunction caused by the elevated message. ADHD, obsessive compulsive behavior, seizures, and even autism spectrum disorder can occur in a greater number of carriers. So we've learned a lot about problems that are not uncommon in the general population just by studying carriers and their vulnerability to some of these other problems. And so let me just show you here that we look at the messenger RNA levels. That's how much message is produced from the gene, and this goes up. This is the CGG repeat number here. This goes up in the premutation range, and that's what causes FAXTAS, FAXPOI, and some of the psychiatric problems. And then when the full mutation is reached at 200 repeats, the gene is methylated and the message level goes down unless there's a lack of methylation. But in the upper end of the carrier range, there can be lowered protein levels, and that can give you some features of Fragile X. And then, of course, the protein level, the FMRP, goes down once you get into the full mutation range. And so FMRP, this very important protein for brain development and synaptic plasticity, also seems to be deficient among other neuropsychiatric problems, not just Fragile X syndrome and some premutation carriers, but in schizophrenia, there is lowered FMRP levels, and in fact, the level of FMRP determines the age of onset and the IQ in individuals with schizophrenia, even though they don't have a Fragile X mutation. Hypoxia that can occur at birth and at other times can lower FMRP levels. Seizures can cause FMRP dysfunction, as I'll show you in a moment. This has to do with research that has been done in animal studies of early seizures, and I'll show you that in a moment. FMRP is also a very important protein because it regulates the translation of hundreds of other messages into their respective proteins. And so these are just some of the messages leading to proteins that are regulated by FMRP. And many of these here in this big circle are messages and their respective proteins that are associated with autism spectrum disorder. And here we have messages and their respective proteins that are associated with mood disorders and schizophrenia. And so FMRP regulates all of these different messages leading to their important proteins for brain function. So in a sense, FMRP is deficient in many more disorders than Fragile X syndrome. Here it shows the deficiency in schizophrenia compared to controls. And here we have the level of FMRP and IQ. And this is in individuals with schizophrenia here. And as you can see, the level of protein correlates closely with IQ. And even in the general population, even in controls, the level of FMRP, or how much protein you have, does correlate also with IQ. And of course, in those with Fragile X syndrome, the level of protein is related to your IQ, such that those with very low protein have a very low IQ, as in Fragile X syndrome. So this is a disorder that's taught us a lot about many other disorders. This just shows in brain studies, here's controls, and here's other neuropsychiatric disorders, bipolar, depression, and even schizophrenia. They all have lowered levels of FMRP, and even in patients with autism, there can be lowered brain levels of FMRP. These are in individuals that don't have a Fragile X mutation. And in early life seizures, the yellow here is a staining for FMRP, And in an animal model, it's actually a rat model of early life seizures. When seizures occur, FMRP pulls away from the dendrites and the synaptic areas towards the cell body, so that leaves the synapse deficient, if you will, of FMRP. And so repetitive seizures can cause a transient deficiency of FMRP, and for many disorders associated with autism, including neurofibromatosis, Fragile X disorders, but also tuberous sclerosis, the more seizures you have, the worse your autism is. And that's why it's very important to treat seizures early. These are two brothers here that have just the pre-mutation. They don't have Fragile X syndrome, and this is a study that we did of boys who presented as probans. That means the person with clinical problems who presents to the clinic versus their brothers who are detected who have a pre-mutation but are not the probans, versus the brothers who do not have a Fragile X mutation. As you can see, ADHD and autism spectrum disorder are very common when a boy presents to a clinic with clinical problems. And here's a proband here who, when he presented, had some autistic features along with anxiety. And here's his brother who has anxiety and ADHD, and they both have a pre-mutation at a similar level. And here they are 4 years later. The youngest brother here is seen right here. And the youngest brother had ADHD and anxiety and social deficits, and he responded very well to sertraline, which is an SSRI, meaning a selective serotonin reuptake inhibitor. It's an antidepressant medication. Mother thought it was a miracle drug. It really helped his anxiety. Now he's in a normal classroom. He has a normal IQ, and he has many friends. However, this boy went on to have multiple seizures that wasn't treated initially by the pediatrician, and then after the second or third seizure, he did get treatment, but the seizures actually continued and were actually hard to control. And actually, he regressed over the last 4 years, and his IQ declined significantly, and now he has very severe autism with low verbal abilities, about a 30-point IQ drop from here. So this just shows you what seizures can do to exacerbate autism, particularly in a pre-mutation carrier. This is a family. The mother is here. The grandfather is here, and the grandfather has FXTAS, or the Fragile X associated tremor ataxia syndrome. He passed the pre-mutation on to his daughter, and then she passed the pre-mutation on to her two sons. And neither of them has the full mutation. So you can see significant clinical involvement in pre-mutation carriers. These are just some of the problems that we see in the pre-mutation, not only psychiatric and some developmental problems, but about 40% of the women can develop hypothyroidism, fibromyalgia, lupus, and some other autoimmune disorders, including even multiple sclerosis in a low percentage of patients. Other neurological problems like migraine headaches, sleep apnea, restless leg syndrome, memory problems, foggy thinking, hypertension, erectile dysfunction, these can all happen before the development of tremor and ataxia associated with FXTAS. And in males, less so in females, we see memory deficits and cognitive decline. These are a variety of molecular problems that that lead to many of the clinical symptoms in pre-mutation carriers, and we'll talk about that more tomorrow. I don't want to mess up your mind with a variety of detailed molecular problems, but I thought you would like to see a picture of someone with FXTAS. By the way, the brain atrophy and white matter disease can occur. We discovered inclusions in the neurons, and this can occur throughout the limbic system. This is the amygdala with inclusions throughout the amygdala and other parts of the limbic system. And let me just show you what the tremor can look like. it's an intention tremor that can be there at rest, and it can be quite coarse at times with finger to nose touching. It's pretty obvious. And this is a very brilliant woman who had a PhD. It's not there at rest usually, but sometimes it can be. But when it starts to interfere with writing, she had a PhD and was a college administrator actually, and had to retire early because of difficulty with writing because of the intensity of the tremor. She has a gifted IQ, but the tremor definitely interferes with eating and a variety of other activities. And then ataxia can also occur with frequent falling. And we have a variety of treatments. Exercise and SSRIs are helpful for stimulating neurogenesis. There's a lot of oxidative stress. We try to have people avoid toxins because smoking and alcohol and drug abuse can be very problematic and bring on FACS tests sooner. The neurons of premutation carriers are very vulnerable to environmental toxicity. They die more easily in culture. And then we have a variety of cognitive programs. But we're very excited about allopregnanolone treatment. Allopregnanolone is actually a natural neurosteroid that is very high during pregnancy. It stimulates neurogenesis. It's a GABA-A agonist, and it promotes remyelination and regeneration in the central nervous system. And the FDA approved it for an IV infusion once a week for a 3-month period. So we're excited about using allopregnanolone. Actually, I'm interested in even trying allopregnanolone since it helps memory so much. And you never know, these new treatments, it's being tried also in Alzheimer's disease because it can dissolve the beta amyloid plaques too. So this is a new treatment. It may also be helpful for Fragile X syndrome, but we're going to try it with FACS tests first. This just shows how there can be enhanced cell death in premutation neurons by 21 days in culture. So the premutation is a genetically vulnerable population for also studying environmental effects, and we're very interested in that, in how that can teach us more about environmental toxicity that can exacerbate autism too, because we see autism very frequently with the premutation. So FMRP, as I mentioned, has many functions, not only transporting messenger RNA to the synapse, but controlling translation. And in the absence of FMRP, there's upregulation of what we call long-term depression, not psychiatric depression, but thinning of synaptic connections or weakening of synaptic connections. There's downregulation of the GABA system, which is the inhibitory system in the brain. There's increased oxidative stress and a variety of other problems that is related to Fragile X syndrome. So here's FMRP down here. It is hauling messenger RNAs to the synapse. And at the synapse, it regulates, as I mentioned, translation. Here's the metabotropic glutamate receptor 5 system that can lead to long-term depression or weakening of synaptic connections. And FMRP puts the brakes on this system. It's inhibitory. And when FMRP is deficient, then this system leading to long-term depression is upregulated. It produces more proteins here that pull in these AMPA receptors, and when you have a strong synapse here, it can make that synapse weak by pulling in these AMPA receptors. And this is thought to be the main reason why there's intellectual disability in Fragile X syndrome, because of these weak synaptic connections. This is called the mGluR theory. So we thought that giving mGluR5 antagonists would cure Fragile X syndrome. This was one of the first targeted treatments. So the mGlu-R5 antagonists can downregulate this system, and there have been several that have been tried. I'll also mention a little bit about minocycline that lowers MMP9 and R-baclofen. We're looking at lovastatin here, but there's a variety of targeted treatments looking to reduce these neurobiological abnormalities. So the first one we tried was Phenibom, and this was probably one of the best days of my career because I had a Fragilt X guy here who was perseverative and anxious, and we gave him some Phenibom to lower his mGlu-R5 system, and he started talking more clearly, became less anxious. He did very well on a continuous performance task, and we thought, oh my God, we're going to cure Fragilt X syndrome. Oh my God. And his mother, as you can see here, was very happy, and we were all cheering. He did very well. And this is just a pre-pulse inhibition test that improved with Phenibom. The problem is that the company that made Phenibom actually went bankrupt because they were making a long-acting preparation of Prozac for autism that wasn't efficacious, and so Neuropharm, this company, went bankrupt, and we lost Phenibom. But there were other mGlu-R5 antagonists that have been tried by Novartis and Roche, but none of them actually, even though there was some improvement, the studies that were done, the behavioral studies that were done to document improvement did not show benefit. And so both of these companies are out of the Fragilt X field right now. There's another medication, R-baclofen, which was a GABA B agonist that also did not show benefit in autism, and so that company went bankrupt. Autism studies have a tendency to bankrupt pharmaceutical companies. But in the adults with Fragilt X syndrome who were treated with R-baclofen, there wasn't benefit, although in the children ages 5 to 11 who were treated with R-baclofen, there was benefit, but this was seen only after the company went bankrupt, and the primary outcome measure here, the aberrant behavior checklist, was not quite significant. So as you can see, it's sometimes very hard to show benefit of medications in some of these targeted treatment studies. We've also done studies on minocycline, which is an antibiotic that lowers MMP9, and this protein is too high in Fragilt X syndrome and interferes with synaptic connections. And so we thought that minocycline could lower MMP9 and therefore help with individuals with Fragilt X syndrome. As you can see here, MMP9, which stands for matrix metalloproteinase, is too high in Fragilt X syndrome compared to controls, and minocycline in our control trial actually can bring it down from baseline too high, gets better with minocycline, and then when they're on placebo, it goes up. And these are just 2 patient examples of that. We did show some benefit of a minocycline study in kids between the ages of 6 and 17 that we published. As you can see here, minocycline is in blue. There was a bit more benefit here, but it wasn't dramatic. And so it was just barely significant. And some individuals do better with minocycline than others. This is one of my most severe adult patients with Fragilt X syndrome. He didn't tolerate any clothes. He has severe autism. He only sits in this part of his room at home and plays with things. And he's in his late 20s here. And it was impossible to get him to come into clinic. He was nonverbal, aggressive, and they couldn't get him out of the house. And so we were doing the minocycline study, but it only went up to age 17. So I said to the dad, let's just give him minocycline and see how he does. And after 2 years on minocycline, he was able to talk better. He was able to tolerate clothes, well, almost. He was able to drink from a cup instead of using a sippy cup. His aggression is gone, and we hope to bring him into clinic, although he hasn't come in yet. I know he's not reading this magazine here, but at least he's sitting down and looking at the pictures. So he's actually much better on minocycline, and believe you, I tried every medication known to man before the minocycline with no significant effect. And so the minocycline actually has worked the best with him so far. So it can have some effects. I must say that treatment of kids with Fragilt X, I think, goes most efficaciously in the young children. And we did a study of sertraline, again, an SSRI that blocks reuptake, so it allows serotonin to stay in the synapse longer. And it's known in the field of autism that serotonin is deficient in the front part of the brain from PET studies. And so sertraline can also calm down the anxiety. And so I started using it clinically, and in fact we did a retrospective study of individuals either treated with sertraline, as you can see here in expressive language, and this is compared to those not treated with sertraline, and this is age here, and this is the language level, and the trajectory of language development looked to be much better on sertraline for both receptive language and expressive language compared to those not on sertraline. So then we decided to do a controlled study once we saw these data from a retrospective study that we published. And the controlled study of low-dose sertraline with children ages 2 to 6 is using just 2.5 to 5 milligrams depending on weight, so it's very low. And here's the analysis of the first 30 patients who went through this study, and we've put through 54 patients now, and we're going to be finished with the study in July when the last patient has his last data obtained. This is a 6-month study for each patient, and this just shows those on sertraline are in red here, and those on placebo are in blue. This is just a clinical global impression scale. And as you can see, the many more did well on the sertraline compared to placebos. So we hope that this will show benefit. I can tell that my time is almost up. So let me just also show an example. Here's a little girl that at 18 months, her receptive and expressive language was at the first percentile. We put her on a very low dose of sertraline and saw some improvement in her language. And then we added minocycline when she was 2 at a low dose, and she had even further improvements. Now she's 4, and on the Stanford-Binet, her full-scale IQ is 100. So she has done extremely well. She has a normal IQ. She had a very poor activation ratio, meaning only 24% of her cells had the normal X as the active X. So she was thought to would have come out with a poor IQ, and about 30% of girls with the full mutation are intellectually disabled, and she did very well. I just want to finish up with insulin-like growth factor, or IGF-1. This has done very good things for patients with Rett syndrome. We have now initiated IGF-1 treatment in individuals with Fragilt X, so we have high hopes that this will be very helpful. This is a multi-center study funded by a company from New Zealand called Neuron. And I just want to say that when you use targeted treatments to strengthen synaptic connections, you always have to use educational and behavioral interventions, and we've used a variety of different reading and attentional programs. Even iPad apps are very helpful for many of these kids, and for those that are nonverbal, many AT devices have been helpful. So we really promote multimodality intervention, behavioral, educational, and targeted treatments. And I just want to thank my collaborators. So there is a bright future ahead for Frambu and for many kids and adults and even aging people with targeted treatments. Thank you.
Thank you, Randi. Very, very exciting and promising results. And I have to say, and you mentioned it yourself, this was a taste of your big lecture tomorrow.
Yeah.
So I think we were very curious to hear more about this.
Yeah.
I'll get you some flowers as well and can bring it to your hotel room at least.
Wow. Thank you.
Thank you so
so much. Thank you.
Thank you.